Can the coronavirus pandemic be stopped? The World Health Organization declares the outbreak a pandemic, and Donald Trump finally joins other countries in taking draconian measures to stop the spread. But are travel bans enough? This is Inside Story. Hello again, I'm James Bays. What started in a single Chinese city is now a pandemic, so far infecting at least 120,000 people in more than 100 countries. World leaders are warning the coronavirus crisis is going to get worse, but is not unstoppable. The measures to limit the spread vary from simply washing your hands to complete isolation. And it's not always your choice to decide how to protect yourself. Governments have taken drastic action to help contain the disease. China and Italy have locked down entire cities, hundreds of millions of people staying at home or off work. Football matches and other sporting events are cancelled or played behind closed doors. The US president has banned all transatlantic flights from Europe, except the UK, for 30 days. And he's announced help for companies struggling to stay in business.
We are at a critical time in the fight against the virus. We made a life-saving move with early action on China. Now we must take the same action with Europe. We will not delay. I will never hesitate to take any necessary steps to protect the lives, health, and safety of the American people. I will always put the well-being of America first. If we are vigilant, and we can reduce the chance of infection, which we will significantly impede the transmission of the virus.
We'll hear from the spokesperson from the World Health Organization in just a moment, but this is how the pandemic was announced.
We're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. We have therefore made the assessment that COVID-19 can be characterized as a pandemic. Pandemic is not a word to use lightly or carelessly. It's a word that, if misused, can cause unreasonable fear.
For more on this, we're joined from the World Health Organization headquarters in Geneva by Tarek Yesharevich. Thank you for joining us, Tarek, spokesperson for the WHO. For weeks, you've declined to use the word pandemic. You're now saying pandemic now. What's changed?
Well, first, we should really try to explain what are the categories that we are using at the World Health Organization. On January 30th, WHO has declared public health emergency of international concern, and this is the highest level of alarm, and this is the category under international health regulations. Now, what we have seen in previous weeks, that more countries are reporting laboratory-confirmed cases of COVID-19, and we can see the trends that even more countries will likely be reporting, and more people will be exposed to the virus, and therefore, Director General described the situation as pandemic. However, our advice did not change at all, nor what WHO doing, nor what countries should be doing, and that is basically still try to contain the virus, try to find people who are sick, test them, treat them in the hospitals, make sure that we understand the transmission chains, and try to, in that way, to reduce or at least slow down the transmission of the virus everywhere where it is right now.
Well, when I look at your own website, it says a pandemic is a worldwide spread of a new disease. Surely that's been going on for a long time. Surely what the public need is just clarity from your organisation.
Well, look, we were very clear from the beginning. Already in mid-January, the Director General has said that in China, you will remember when China had to deal with dozens of thousands of cases, that it was emergency in that country, and we did declare global health emergency. That did trigger recommendations from WHO. But since January, we've been providing technical advice, and we keep doing that as we understand the virus. We try to update what we know and what we say to countries they should be doing. And this goes from clinical management to laboratory testing to infection prevention and control measures to risk communication to mass gatherings and all those elements of response that are needed. What we are really saying is that it can be qualified as pandemic, but it can be controlled. We have seen that countries like China, South Korea, or Singapore, with a strong basic public health measures, managed to slow down the number of newly infected people. And this is something we hope all countries are now able to do, because we had those 2 months to prepare. And WHO was instrumental in helping countries with the weaker health systems to do exactly that, to get to the point they can detect, provide medical care for those who are sick, and at the same time do containment measures.
Your boss, Dr. Tedros, the Director General of the World Health Organization, says he's deeply concerned by alarming levels of inaction. Where are those alarming levels of inaction? Be specific about countries.
Well, it is really important to stress that for weeks now we are saying this is not something only for the ministries of health and health workers. This has to be the response that will be carried by all of the government approach, because the effects of the crisis, as you can see in many countries, is on all of the society. Look at the economy, look at the travel, and this is something that has to be taken as an emergency.
Yeah, but Tarek, you've not answered my question. And I've been watching your World Health Organization briefings for weeks now. Why are you not specific about the countries where there are problems? You keep saying that every country is doing a good job. Well, clearly they're not. This is spreading wildly.
James, I'll let you finish your sentence, so hope you will do the same. What we have been saying basically is that it's not a time for stigmatization. It's not a time for pointing finger. There will be a time where we will look into lessons learned, and then we will probably see that things could have been done better by everyone, including WHO for sure. But now the time is for solidarity. The time is to share experiences, share advice, to learn from countries who have been in this crisis before other countries, to see what China has done right, what South Korea has done right, and what needs to be done depending on the level of pandemic your country is in. It's not the same thing if you have 20,000 of cases or if you have just a handful of people who are infected. But the point is that everyone has to step up and everyone has to take this as an emergency.
Tarek Yasharevich from the World Health Organization, thank you. Let's discuss this further with our panel. With me in London, we have David Alexander and Mark Honingsbaum. David is a professor of risk and disaster reduction at University College London, and Mark is a medical historian and author of the Pandemic Century, 100 Years of Panic, Hysteria and Hubris. Welcome to you both. Can I start with you, David, because there's a bit of your biography you didn't really explain. You are Italian. The worst place in Europe is Italy. And you previously had a big job in Lombardy, which is one of the worst areas affected in Italy. So first, perhaps, from the people you're speaking to there, what is the situation on the ground that you're hearing?
In Italy at present, there is a big push to get the situation under control, if that is possible. The first question you might ask is, why Italy? Well, I suppose two possible reasons come to mind, apart from merely bad luck. And one of those is that it is a place of encounter where many people come into the country and many go out of it. And the other is that it has a very large elderly population who are therefore more at risk than those who are not elderly, generally speaking. So in Italy, the health system is regionalised. It isn't excellent everywhere, but it certainly is in the affected areas. In the north, the health system is absolutely excellent. I would say that currently it is functioning pretty well. It is managing to cope with normal general medicine and at the same time with the influx of COVID cases. I think the strategy of the country is to create a lockdown and ask the population to conform and to do the right thing in order to make a big push to get this under control.
Because I assume the danger is the health system getting completely overwhelmed. And I have seen some reports, tell me if you believe these are accurate or whether they're generalised, that in certain places doctors have had to decide who to give care to, operating almost like in wartime conditions, battlefield triage.
Well, they have to do triage anyway, even on an average ordinary day. So it is perfectly normal for a doctor to decide who to give care to at any particular moment. And they would do that by working out which are the cases that take priority. And that happens in any hospital, accident and emergency department at any time. So obviously that will be intensified under the current conditions. But I do believe, as far as I'm aware, they're managing to cope pretty well at present, unless there is some really big change with a massive influx of cases. But if that happens, then I think you'll see a fairly large, if not a gigantic, transfer of resources to try to cope with that better.
Mark, you quite literally wrote the book on pandemics. We now have, finally, the World Health Organization seems to be dancing around this term. They now are using it. Yeah. Why is that significant in your view?
Well, I mean, it's significant because it makes clear what has been, frankly, blindingly obvious for at least the last 2 weeks, if not longer, that this is a true global pandemic. What that does is it alerts us to the parallels with other pandemics in history. So the most recent pandemic before this one was the 2009 swine flu. But there are also some alarming similarities with the 1918 to 1919 Spanish influenza pandemic, which was the largest pandemic of modern time.
Well, clearly that was very, very serious. Swine flu, in the scheme of things, I'm a journalist who covers big stories. I don't remember that as a huge story.
It was a very big story at the time. I was also actually working as a journalist in that period. And there was similar panic. On the first day that the NHS in this country launched their sort of hotline, so many people called up that it crashed. So it happened in a much shorter time frame. The difference was we didn't follow this over 3 months as we've been doing. There's been like a drip, drip, drip and a steady gathering of expectation and now alarm. So I think that never before has a pandemic been watched in such detail in real time from the beginning.
David, I'm sure as a medical man, there's the medical side, but there's also the public messaging side and knowing what to say at the right time to avoid panic buying, to avoid a massive scare.
Well, you're right. Actually, I'm not a medical person. My field is emergency planning and management, and that involves considerable interest in things like social media and so on. It is extremely important to have messages that are clear, consistent, concise, and repeated. Clear, consistent, concise, and repeated. Now, obviously, on occasion, you have to change message, but you should do so in a manner that makes it clear that the situation has changed. It therefore demands a new message. We've had plenty of instances in the past where messages have not been clear, they've been contradictory or self-contradictory, or they simply haven't kept up with developments. We have a dynamic situation and it demands that authorities come up with the right information and have a strategy to deal with rumour, misinformation, and all the rest that can so easily be propagated by social media.
You say in the past, I could say if I go to the US, in the past couple of weeks, because President Trump has said it's flu or just like the flu. He said he himself is a great medical expert. After just 15 cases on the 26th of February, he said that the virus would soon drop close to zero and that there'd be a vaccine in a couple of months. The reaction to both of you when you're trying to get public health messaging out there to those sort of comments coming from the most powerful man in the world, Mark?
I can say, I mean, it's appalling is what it is. President Trump seems always to think of his own interests first and the rest of the world's and even the rest of America's second. There is no prospect of a vaccine in the next 6 months. This is a very serious, fast-spreading illness. What he's trying to do, obviously, is talk down any panic and stop it infecting the economy and stock markets. But frankly, we're beyond that point now. It's far more important now to realise we need to take this short-term economic hit and listen to the experts and try and mitigate the worst effects of this pandemic.
David, your view on Trump's comments. As Mark said, he's been, I think, focusing on the stock market, but in the meantime, the actual situation is just getting worse and worse.
Well, from the United States and from other countries, it is very clear that we need a steady hand on the tiller, and that is precisely the opposite of what we're getting. We have a policy that is not likely, in my view, to be effective, of excluding certain people but not others. It rather reminds me that I've read that in the 1918 pandemic, the Spanish closed the border with Portugal. They did not allow the Portuguese to enter Spain, but they allowed Spanish citizens to go back to repatriate to their own country. But really, this is an example of something so inconsistent that it's really not likely to have much effect at all in terms of containing the virus. It requires measures that are decisive, but they're perhaps not excessive, that they are well thought out and that they are based upon expert advice. Now, I do understand that expert advice can be contradictory because not all experts agree when you have a very complex situation. But nevertheless, it is most certainly possible to have and to utilise expert advice to do something that would reduce the risk or contain it, or at least not make things worse. And I think he's doing precisely the opposite to that.
Mark, some of his language, he said in his speech, this is the most aggressive and comprehensive effort to confront a foreign virus in modern history.
Well, yes, so I mean, the language is really important at a time like that because words are very highly charged. So, I mean, frankly, stigmatising any one social group or nation for this problem is just ridiculous. The thing is that America rightly prides itself on having a generally excellent health system, but they've already got a lot of fundamental things wrong that public health systems do much better, such as getting out testing kits. The fact is that nobody in America really knows how many people might be infected because, first of all, they sent out faulty testing kits, and it's only now that they're ramping up production. And I fear that also in this country, it's already clear that, we're not capable of testing everyone who might now be ill in Britain. So we're not really in a position to do what South Korea did very, very effectively, which was, go to people's homes, take samples and chase down every contact. Because what people have got to realise is that there is a difference between this virus and flu. This virus mainly travels and spreads within family clusters or people who have lots of social interactions, OK? So you do have an opportunity, if you trace contacts and do proper testing, of closing down those transmission chains.
David, on the specific that seems to be the main centrepiece of the Trump policy right now, which is cutting all those flights from Europe, and oddly not the UK, even though there are some countries in Europe that have fewer cases than the UK. Right. Is that in any way effective?
I don't believe it will in any way at all be effective. One thing to note about the US is that, yes, it is brilliant at certain forms of healthcare, but it is something like number 87 in the ranking of healthcare systems in terms of access to and quality of healthcare for individuals. I have personal experience having lived in the US for 22 years, and frankly, I did not find the health system to be good at all. Compared to European health systems, it was extremely poor. Another thing to bear in mind is that we tend to treat the United States as a country, but it is a federation. And therefore, quite a bit is done at the state and local level. And if you look at emergency preparedness in the US, it is highly variable from one place to another. The federal government can have an influence on that, but in certain things it cannot interfere too much because state responsibilities are constitutionally state responsibilities. So it can certainly encourage and it can support, but a lot of the emergency management stuff that is done in America is to support the states and the counties and the local authorities rather than to supplant them. Now, that could change because this could be declared the sort of national emergency where the national level would override the state and local level. However, it cannot do so very effectively because it is simply not built to do so, given the Constitution.
When you look at the countries that are affected, it's well over 100 countries now around the world. I think we know the really bad places, and we've been talking a moment ago about Italy, which is clearly the worst place in Europe. But where else worries you, Mark? I mean, the problem, I think, with the statistics is they might well be countries that are doing well because they found lots of cases, I suspect, in some cases.
Well, we have a pretty good idea of which countries have done well. So I already mentioned South Korea, who did it, and obviously Singapore, who have a brilliant health system.
But, for example, a massive jump in Denmark recently, where the cases doubled. That might be good news, not bad, might it
could be. They have a smaller population. I mean, but you asked me which country am I worried about. Yeah. I would say Russia. We've heard very little about what's going on in Russia. They share a huge land border with China, and also they have lots of travel between Russia and Europe. So I'd be worried about Russia at the moment.
David, in terms of what should be done by countries, the whole idea of social distancing, lockdowns, at what point do you go to that level? Italy seems to be playing catch-up. Are some of the big European countries behind the curve here?
Well, there is a tremendous dilemma. The trouble with pandemics is that they are both a public health problem and a socio-economic problem. Somehow you have to balance the economy, and there will be people who are suffering dreadfully because their incomes are depressed or absent as a result of the cessation of certain activities, particularly in the hospitality and transportation industries, for example. And people are dependent on their incomes to get by. So to what extent social welfare will swell up and close that gap, I am not at all sure, but I wouldn't rely on it too much under the way things have gone. So in that respect, yes, something has got to be done to make a balance between the two. On the other hand, if we don't have social distancing, we're likely to see the greater proliferation of the disease. I suppose now the big question is, for how long? In other words, currently, for example, in Italy, we don't really have any measures for May, although it's obvious that those are under intense consideration. Likewise, in Britain, we're thinking about the short term, but we need to extend the scenario, and the scenario is more of an exploration than it is a prediction, to try to decide, well, what are we going to do in the slightly longer term or even the much longer term?
Mark, just quickly to bring up the section of the population that are probably most at risk, the elderly.
Absolutely.
How concerned are you about old people living on their own, old people in residential homes, for example?
Yeah, so I'm very concerned. So I have an 88-year-old mother who lives here in London, not far from me. And I started actually telling her 2 or 3 weeks ago, look, Mum, you know, maybe you should consider not going out to the theatre, you know, not going on the bus, and just reducing your social interactions. And that is my main concern. I think, look, we have to get this thing in perspective. For the vast majority of us, this is going to be a mild illness, or in the case of young people, they may not even notice it at all. But for some sections of the community, such as, you know, the elderly, it could be very, very serious. And this is really about what we can all do as a community to slow the spread of this virus so that when those people do get ill, hospitals can cope and they're not overwhelmed. I'd much rather stop this earlier than wait till it gets to the hospital door.
If I could add something as well, it may be a slightly far-fetched parallel, but in 2003, with the heat wave, there was an estimated 70,000 excess deaths, largely among elderly people. Subsequent to that, it did have the beneficial effect of throwing attention on the problem of the elderly living alone, such that there were mechanisms. The extent, however, to which they can be extended from heatwave surveillance and monitoring and warning to coronavirus protection is currently not apparent.
Thank you very much, David Alexander and Mark Honingsbaum here in London. Wise words and some good advice. If you missed any of it, at aljazeera.com as ever. You can catch up with the show again at facebook.com. Your views and comments, as ever, are welcome. Or if Twitter is your preferred social media, you'll find us there too. Details at the bottom of the screen. Keep washing those hands. And from me and our teams in Doha and London, see you soon.